Department of Health reminds local government units and concerned volunteer groups to exert maximum effort to observe social distancing in evacuation centers to prevent the possibility of COVID-19 spread amongst evacuees. Individuals who are vulnerable to catching this disease, including the elderly, pregnant women, children and people with underlying conditions, are encouraged to take extra precautions as they await to go back to their respective homes as soon as possible. Mark Fitalco reports.
The Department of Health warned that the spread of COVID-19 in the evacuation centers is a very strong possibility following the onslaught of Typhoon Ulysses. That's why Health Secretary Francisco Duque III reminded the safety officers to be vigilant in monitoring the compliance with the minimum health standards among evacuees. These include wearing of face mask, hand washing, and physical distancing.
Naman pangunahan ang posibleng mangyari dahil maraming posibilidad. Pero hangga't tayo ay sumusunod sa mga panuntunan, sa abiso, health advisories na talaga naman ipinakakalat natin ito na makaabot sa pinakamaraming bilang ng ating mga kababayan.
Although the DOH admitted it is very difficult to observe physical distancing in these situations, it however assured the public there are designated teams who are closely watching out for symptoms of COVID-19 among evacuees. It also reminded those vulnerable to the disease and that higher risk for COVID-19, including the elderly, pregnant women, and those with comorbidities, should be isolated and transferred to other quarters. The DOH also urged LGUs to assign 1/10 per family in evacuation centers.
It's a challenge still, no? Pero sinisiguro po natin kahit papaano ay naipapatupad po natin itong mga minimum health protocols natin.
According to the DOH, it has distributed more than 26 million pesos worth of medical supplies to affected residents in Metro Manila and Calabarzon. The agency also reminded local officials to continually provide face masks to evacuees as its effectiveness to control infection diminishes if it gets wet. Meanwhile, according to the DOH, it would take 3 to 4 weeks to see the effect of typhoons on the increase of COVID-19 cases.
Nandyan po yung threat na maaring tumaas ang kaso dahil sa pagsasama-sama ng mga tao sa evacuation areas. At atin pong makikita yan, yung effect na yan, in 3 weeks to 4 weeks para ma-analyze natin.
Mark Fitalco for The Nation.